Welcome to the first episode of Paging Dr. AI. I'm Sohaib, a tech entrepreneur. I'm working in AI and healthcare. I'm a pharmacist. Then AI happened, IT happened, tech happened. I'm kind of trying to bridge the healthcare with technology, building up solutions, exploring and learning as I go.
And I'm Dr. Vishraj Rathod. I'm a family physician who's worked in Canada and now working in the UK. The goal of this series is to help our colleagues understand AI and how to use AI to help us. As a clinician, I know our job is stressful as it is. We have so much on our plate: patient care, administrative tasks, referrals, forms. And I don't necessarily know that if all our colleagues really know the different ways technology and AI can help us.
And again, AI is such a buzzword. It's everywhere in healthcare conversations right now. But for most of the clinicians, you're already busy, and it still feels so vague and confusing. I've learned it firsthand from doctors I've met that it's kind of intimidating as well. Like there's a lot of these things happening. Again, from my understanding, unless a doctor is very much sure about the studies and the literature that goes behind a product or a concept, let's say for AI, they're not sure how to use it because it's healthcare, and it's an impact that's way greater than using AI in some daily, let's say for ChatGPT, I'm generating a proposal of some sort, right?
You're absolutely right. AI is a tool. And because it's a tool, especially as a clinician, we have so many things that we have to think about. For example, privacy, confidentiality, those are the two main pillars of healthcare. Absolutely, it's something we have to keep in mind, and we have to be very careful about it. But at the same time, as a clinician, we use AI all the time, whether we realize it or not. For example, if our EMRs highlight drug interactions based on a patient's medication list, that's AI. But even outside of our clinical realm, everyone sees AI. Netflix recommendations based off our viewing history. Google Maps suggesting a particular route to avoid traffic. Spotify or Apple Music telling us, hey, we're going to love this song because we've listened to variations of it. That's all AI.
So true. And I think this is what we are going to demystify here. We'll break it down, what it actually is, what it isn't, where it already shows up in practices. It could be from EMRs, it could be scribes, diagnostics, right? And at its core, AI isn't magic. It's simply algorithms. It's simply code that's learning from data to make predictions, to make decisions. In plain English, it's really good at spotting patterns. Let's say I'm showing it 1,000 pictures of cats, and we'll figure out what makes a cat a cat. That is AI. That's it. And in the medical world, think of AI like a super fast, tireless doctor or a resident who has read millions of patient charts. They can surface insights quickly, but they still need guidance to make the right call. And I think that's the key, which kind of says AI is never going to replace healthcare professionals. It's a tool, like you said, just like the EMR or like any other tool that you use. It's only as good as the person who's using it.
Absolutely. And the conversation that we're having now about AI in healthcare, 10, 15 years ago, we were having that same conversation about EMRs in healthcare. The privacy, the confidentiality, who owns those notes, computers can be hacked. Those conversations happened at that time as well.
It's like we are seeing three different stages because we have seen those Nokia phones, double one, double zeros, and the hard ones. There was no camera first. The camera came in, then there was gaming, and then there was internet, there was web, and now it's AI. So it feels lucky to kind of have seen all of those now that I think about it. And here's another big one, right? AI isn't sentient. It doesn't think like a person. It doesn't feel. It doesn't have. Definitely doesn't have judgment. It's objective. It's emotionless, and it's purely logical. And that matters because so much of what clinicians do depends on the human side. Empathy, sympathy, listening between the lines, communicating, I mean, if I go and visit a doctor and if I go visit a bot, I would prefer a doctor just because he's human. Now, let me throw this out there. Is Dr. Google considered AI doc?
Absolutely. And we all know how well Dr. Google diagnoses patients. For example, a patient comes in with left-sided chest pain. It could be a heart attack, it could be reflux, it could be a pulmonary embolism, it could be costochondritis. And we all know how well Dr. Google diagnoses patients. It misses so many things. It scares people.
I've heard so many times from my family, from friends, hey, I Google my symptoms and now I'm terrified. Like, Dr. Google is great at scaring people, that's for sure. And it doesn't consider the big picture. Let's say a 20-year-old with no history who just crushed a workout and probably pulled a muscle. He's not the same as a 70-year-old smoker with chest pain, right? I mean, it's general.
Absolutely.
And I think that context matters, and that's where human judgment comes in. But here's where AI actually adds value. It can help catch those subtle things that could be missed. At the end, we're all humans. Tiny changes in the ECG. Radiology is a huge example. It can flag abnormal lesions on a CT scan. In dermatology, it can compare images, suggest differentials, especially for rashes, not to replace radiologists or dermatologists, but to give them an extra set of eyes, a very fast, very sharp second opinion, if you will.
Absolutely. And actually, rashes is one place where I use AI quite frequently. If there's a rash that I'm not quite sure what I'm dealing with, that's one of the most common ways to use AI in a clinical setting. And the other thing is as a family doctor, I use this quite a bit. And I'm sure my family medicine colleagues will agree and be familiar with, is AI scribing. Tools
Hmm.
such as Heidi, Tally, these are becoming more and more popular for clinicians nowadays to help them save time in documentation and charting. Now, because of that, governments have started introducing guidance for this. Ontario MD has just recently released their first vendor list for approved AI scribes. The
Yes.
NHS has approved their guidance, it released their guidance rather, just in April of this year. It's AI is showing up clinical workflows already.
Yeah, and here's the thing, AI isn't just limited to patient care. It can also step back and look at the whole system in its entirety. For example, hospital ER that keeps getting overwhelmed. So AI can spot patterns. It can do triage. Okay, why it's busier at certain times. And then based on that, it could help accommodating staff and suggest strategies, for example, to ease those delays, right? Now, that's operational in AI, not just clinical AI. But of course, with all of this potential comes one of the biggest concerns in healthcare, privacy and security. At the core of medical profession is confidentiality. So, what do you think, doctor? Like, what do clinicians really need to keep in mind when they start using AI?
What you raised is an excellent point, and this is kind of briefly what you touched on earlier as well, is that AI, like any tool, is exactly that. It's a tool. It needs to be treated with the same regulations, same governance, same rules that any tool needs. We all know how to use our EMR. We know if we're not supposed to do a certain thing, we don't do it. And so we have to keep in mind how to use it, what are its medical legal implications, when it shouldn't be used. And I think this is something that we should discuss in a future episode. But at a very basic level, what I would tell our colleagues is every country, every province, every state has their own guidance in terms of how to use AI. And so, at a very superficial level, the basic rules that I would say, number one, don't use any patient identifiers. Don't
Hmm.
say Mr. XYZ has these symptoms. You can use something like a 51-year-old gentleman with X, Y, and Z. I think that's acceptable. We can upload images, but whatever doesn't contribute to your question or concern, try and black that out. Try and leave that out of the photo. The thing that we have to keep in mind is a lot of these models do use the data that we submit to teach their own models. There is that privacy concern that we have to think about. I know that we said that we wouldn't necessarily talk about any specific models, But I think the four most common ones I think that people should be aware of. ChatGPT is one that I commonly use. There's Gemini, there's Claude, and these work just as well. The one that I would probably recommend clinicians avoid is Perplexity, and that's purely because there are privacy concerns that have been raised with it. But apart from that, as long as you use it in a sensible sense and you use it as a tool and treat it as a tool, I think you should generally be okay.
Absolutely. I mean, that's such an important reminder, Doc. And as we go through this series, we should take time to break down how these systems actually learn, like how you mentioned about perplexity, right? What actually happens, not in a super technical computer science way, but in a way that gives the clinician a solid working understanding. Because, once you know what's really happening under the hood, it becomes a lot easier to judge when to trust AI and when to step in with your own clinical expertise, because there's going to be a huge wave of AI solutions that will come up in healthcare, and not every one of them would be compliant with all of these. Having that knowledge or that exposure as to what actually happens behind the scenes, that will help doctors choose what's best for them in their day-to-day practice.
Absolutely. This is just the primer episode, and we've already covered so much. But what I would say to our colleagues is this is kind of an idea that we would like to talk about during this series. And we would also like to say that if there are any specific questions or topics that you would like us to discuss, we invite you to please let us know, and we'll either try to answer them or discuss them in a future episode as well.
Absolutely. And we hope you enjoyed this first conversation on paging Dr. AI. This is just the beginning. There's so much more to unpack about AI in healthcare. And if you found this helpful, share it with a colleague. Let us know what questions, like Doctor said, that we could probably tackle in future episodes. Thanks for listening, and we'll see you in the next episode.
We'll see you in the next episode.